And welcome back to Living Well. We have with us Dr. Laura Rosch, who is the campus dean of Kansas City University in Joplin. And today we are going to be talking about screenings, how important they are. There are so many different kind of screenings that we're going to be talking about. First off, thank you so much, Dr. Rosch, for coming in via Zoom with us today because of the inclement weather.
Yay. Thank you, Gary, for having me here. It's so good to see you, and I hope you stay safe today.
And same to you. So let's talk screenings. I was fascinated by this subject because 16 years ago, I went through a battery of screenings that told me I had the potential for heart problems. And so I know, this is really true. And so I know how important it is for people actually at just about any age to start going through screenings, but you are the pro, so tell us about that if you would.
Well, screenings are a wonderful way to determine early presence of disease. And there's a saying, Gary, that goes, a fine doctor, I might massacre the saying, but I'm going to try my best. A fine doctor is going to manage you wonderfully in the hospital. A good doctor is going to manage you outpatient before you get to the hospital. But a great doctor will prevent the occurrence of those diseases. So it's important with the screenings to get in early and get those things assessed.
And I think you make a fantastic point. When do people need to start thinking about getting screenings? At what age?
Right. Well, it does depend on a comprehensive family history, right? So people with a family history of certain types of cancers, we're going to get screened a little bit sooner in age, or have certain risk factors that might make them more susceptible to the development of that disease. For example, for your heart health, and February is Heart Month. So one of the diseases that we know is very, very common as you get older is hypertension. So blood pressure is one of those silent diseases that you can have, and you can have it for years and years. You just don't want to have it and then realize it's presented in the form of a stroke or a heart attack. So you need to go to the doctor and get your blood pressure screened and make sure you're not at risk for that. The other issue that could be very important to detect, because we do know if you have high levels of certain cholesterol, right? The bad cholesterol, that should be screened for as well, because the higher levels can place you more at risk for the development of heart disease. It can clog those arteries and create problems with circulation in the heart. And also diabetes is another one. You can have that for many, many years and not even really realize, have dysregulation of your blood sugar, and all of a sudden you present with perhaps a high blood sugar to the emergency room because you got dehydrated for it. So that's something you can screen for. We do know all these particular disorders sort of carry together, they cluster together, and they create metabolic syndrome that can make you more susceptible to heart attack and stroke and diabetes. So let's get in and get those screened.
Such valuable information. And going down that list of the three that you just talked about, the blood pressure, that's typical stuff that you do every time you go to the doctor. But the other two, they're not always done with every doctor's visit. So should you be asking your doctor about cholesterol and about blood glucose, or should your doctor be asking you about that?
Absolutely. If there's a family history of what they call a family of dyslipidemia or abnormal cholesterols in your family, they might want to start screening sooner. Like some are starting screenings as early as 20 years old, sometimes even sooner in children. We do know that can develop. So yeah, should you talk to your doctor about it? Absolutely. And if your doctor recognizes that you have some of the risk factors that are underlying with these disorders, that they need to screen sooner and maybe screen more often. Same with diabetes. We do know that when you gain sometimes as little as 30 pounds, you are at risk for dysregulation of your blood sugar, right? The pancreas has to work a little bit harder. So that might be something, if you're overweight and you have symptoms, maybe possibly developing, that you ask your doctor about it. And it's a simple screen. It can be as simple as a finger prick, and you can check someone's blood sugar.
This is fantastic information, and we are just sort of scratching the surface about all the necessary screenings. And I know you're going to stick around because later on in the show, Shelby is going to be continuing our discussion with Dr. Rosch. We're going to be talking about a colonoscopy, mammograms, prostate screenings, all of these things absolutely essential to maintain your good health. So thanks once again, Dr. Rosch. If you'll hang on, Shelby's going to be back with you in a few more minutes, okay?
Thank you, Gary. Good to see you.
Great to see you as well. We'll be back with more Living Well after this.
Back again with Dr. Laura Rosch, Campus Dean of Kansas City University in Joplin. We're so glad to be here with you. You get me now. We're trading off. We get to both interview you today. Since we couldn't have you in person, we appreciate you coming via Zoom for us.
Oh, I love being here. Thank you so much for sharing with everyone that's watching the show the importance of screening tests, and we're doing something really good to help people.
Yes,
so great.
This keeps people abreast of what they need to know. Now, you and Gary talked about heart health and those type of screenings. You want to talk about 3 more with me.
Yes, there are 3 more tests that are really, really, really helpful. It can, like I said, be associated with early detection of disease so that we can really stamp out these things progressing onto more serious matters. And the first one, Shelby, is a colonoscopy. It is such an important screening test, particularly for individuals that may have a family history of colon cancers or colon malignancy. In fact, a lot of my friends who are gastroenterologists who perform these tests get frustrated because really, if you can get access to a colonoscopy, nobody should be dying from colon cancer. It's one of those tests that you start doing and screen for, and they can detect things early, and they can be removed, and you can live a full, happy life. So colonoscopies are really important. I know it sounds so unpleasant, doesn't it?
It does.
But I'll tell you, if you do your prep right, you get in there, you get with a doctor that knows what they're doing, can help guide you through. It's such an important test. The other one is the mammogram. They're all kind of uncomfortable, right? A mammogram.
Yeah, none of them are much fun.
Not fun to go to, but the downside is not having it done and being more at risk for the development of breast cancer. So we do know mammograms can detect breast cancer in women and also in men. Some men that might have a family history or risk for it need to start these types of screenings. Usually they start at the age of 40, and they're also linked with doing the self-breast exams. And these are really important tests that we have now that are able to detect malignancies and cancers early. And the last would be the prostatic specific antigen, and that is done in order to detect the men who are at risk for prostate cancer. And generally the screenings start around the age of 55. For some with histories, they might be done sooner and might be done more often, but this is another screening test that's we do know can be linked with early detection of prostate cancer, can help prevent the development or progression. You can get in there and get some early treatment.
And I know a lot of people think, oh, I don't want to do this. I don't want to do the colonoscopy and all that. But really, can you put their mind at ease that that's going to be an easy test? It is what detects things, and it really protects you and helps you live a full life if they would find something.
Right. A trick one of the nurses told me, and I did it. She said, just drink clear liquids the day before. Okay. All clear liquids, everything clear. Then you start the prep, so there wasn't a lot in the colon if you started that day before, and it helps clean everything out. And then they give you some medicine in your vein, right? So you kind of go to sleep, and then you wake up, and you're like, oh, it's done already. So.
Yeah. Yeah, it's relatively simple, but we think about drinking all that stuff and everything, but it's so important, so it's worth it to do it. And the mammogram's kind of unpleasant as well, but it's important, and it's just a few moments of your time that can protect you for a lifetime.
Exactly. Well said, Shelby. I agree. Thank you.
Yes, we appreciate you being here with us and giving us some update on these to keep us abreast of things that we need to know. And I hope a lot of people watching think, okay, I'm going to go ahead and get in on those screenings now.
I do too, because these are ways that we can really prevent progression of some serious diseases, nip them in the bud, and contribute to a good, longer quality, healthy life. And if you have access to them, please go do them.
Yes, please do that. Thanks so much for being with us, Dr. Rosch. We love having you.
Oh, you're welcome.
We'll see you in studio next time.
Yes, ma'am.
Thanks so much.